Good morning, everybody. My name is Pedro Villeda,
My name is Gabriela Ramirez.
My name is Teresa Perez.
and our presentation is on the possible association between diet soda and Alzheimer's disease.
To begin our presentation, we will discuss what Alzheimer's disease is. Alzheimer's disease is the most common form of dementia. This disease accounts for 60 to 80% of cases. Alzheimer's, as well as other forms of dementia, are caused by damage to brain cells. This damage interferes with the ability of brain cells to communicate with each other. When brain cells cannot communicate normally, thinking, behaviors, and feelings can be affected. The brain has many distinct regions, each of which is responsible for different functions. For example, memory, judgment, and movement. When cells in a particular region are damaged, that region cannot carry out its functions normally.
A little background on diet soda is that it is artificial and it has little to no sugar and contains low-calorie sweetener. Some of the artificial sweeteners used in diet soda include aspartame, silicate, saccharin, and sucralose. A majority of the people drink diet soda when they are diabetic or in the process of trying to lose weight. Some harmful effects of the diet soda include increased risk of stroke and possibly affect the other parts of the brain, kidney dysfunction, dental issues, and possible increased chance of cancer.
Based on this information, we suspect high exposure to diet soda to increase the risk of Alzheimer's disease because diet soda has been linked to symptoms resembling Alzheimer's, such as poor memory and smaller overall brain volume. We hypothesize that drinking diet soda regularly, at least 5 cans per week, can increase an individual's risk of developing Alzheimer's disease. We chose to use a case control study to test our hypothesis because we wanted to start with the disease first and then gather history on past exposure to diet soda. Our group of interest, or our cases, will be individuals diagnosed with Alzheimer's. Our control group will consist of individuals without Alzheimer's and without any signs or symptoms of dementia. After we select our cases and controls, we will gather information on past exposures to diet soda through surveys and interviews, and then we will compare them and draw conclusions on whether or not diet soda has a correlation with developing Alzheimer's disease. We will be gathering past information on exposure status in 5-year increments of the past 25 years. For example, the primary caregivers or family members of the cases and the control participants will first be asked about their diet soda consumption in the past 5 years. Then they will be asked about their consumption in the past 10 years, and so on up until 25 years.
Okay, now I'll be discussing the population and our selection criteria. We would select patients with Alzheimer's and patients without Alzheimer's and compare their exposures to diet soda. We chose the Los Angeles County because of its high and diverse population. We chose individuals between the ages of 65 and 74 because Alzheimer's is the most common in these ages. 1 in 10 adults in the U.S. over the age of 65 have some form of dementia. We chose the age bracket of 65 and 74 because these people are considered to be young old, and this is the expected onset age of Alzheimer's. We would enroll cases and controls on a one-on-one basis, meaning our study will have an equal number of cases and controls. We will get cases and controls from senior centers and caregiving support groups from all over Los Angeles County who fit the criteria. We will give a synopsis to caregivers and family members about the study so that they can choose to participate if they believe that they know their family members' diet soda drinking habits over the past 25 years. We will get them to participate by telling them about the study and why we think it is potentially important for future generations. They will only have to take a quick survey and answer a few interview questions.
For our exposure group, the participants will be separated into 3 categories: the highly exposed, the low exposed, and the unexposed. A participant will be defined as highly exposed if he or she regularly consumes diet soda. We define this as an average of 5 or more cans per week. A low exposure would be defined as having an average of 1 to 4 cans of diet soda per week. On the other hand, the unexposed will be everyone who has reported drinking an average of 0 diet sodas per week. After we select our cases and controls, we will gather information on past exposures to diet soda through surveys and interviews. The surveys will include basic demographic questions, questions about diet soda consumption, and questions to determine predisposing risk factors for Alzheimer's. For example, family history, race, heart disease, and type 2 diabetes. If a case participant is found out to have type 2 diabetes, we will not include them in the study due to the fact that type 2 diabetes is a strong predisposing factor to Alzheimer's. For the cases, we will be giving a survey to the primary caregiver or family member to fill out since the individual might not be able to recall information due to memory loss. The controls, however, will be able to fill out the survey themselves since they will be able to recall the information. In the interviews, we will be asking both controls and cases about soda and diet soda consumption. Again, for the cases, we'll be doing the interview with their primary caregiver or a family member who can attest to their past histories.
Our cases will have to be diagnosed with Alzheimer's by a doctor. We will verify the diagnosis with either medical paperwork or calling the diagnosing doctor themselves. This will confirm that we are capturing truly diseased cases. In conclusion, after gathering all the information from our cases and controls, we would analyze all the data to see if there is a correlation between diet soda and Alzheimer's disease.